The ankle lateral ligament injury is one of the most common injuries. It is important that you visit your doctor immediately after the injury and plan a course of action. The doctor will refer you to a physiotherapist who will help you rehab your injury to help minimize recovery time and any long-term effects. The physiotherapist will discuss with you each step of the way how to exercise your ankle, and it is important to note that exercising may cause pain and possibly even worsen the injury. At any point, the patient is allowed not to partake in a certain exercise if they feel it causes too much pain. Consult your physiotherapist or GP before exercising. After a period of resting for 72 hours, the swelling will start to decrease and the pain will lessen. This means the ligaments have reached the point in the healing process where they are not in danger of being re-injured from mild stress, and you are now ready for rehabilitation. The physiotherapist will ask the patient to do many exercises. He will ask the patient to do some general range of motion exercise such as rolling of the ankle and writing out the alphabet with the injured foot, followed by strengthening exercises such as inversion and eversion, band work and proprioception. All are meant to restore movement and range of motion, as well as provide long-term security of the ankle. Strapping and taping may still be beneficial during these exercises to provide compression and support the ankle as you return to full weight bearing. You'll start with range of motion exercises. Writing the alphabet with your foot will work just about every muscle around your ankles, while simultaneously working on full range of motion. Once you can bear weight comfortably and your range of motion is near full, strengthening exercises may be performed. The easiest to begin with are isometric exercises that you do by pushing against a fixed object with your ankle. Invert your ankle against a fixed object and push against it. Be sure to hold your foot and apply force when you invert. Do the same for eversion and hold it. It's important to strengthen the everters to help maintain eversion and prevent inversion. The exercise can also be done using an exercise band. Once this has been mastered, you can progress to isotonic exercises, which involve using your ankle's range of motion against some form of resistance. For this, you can have someone either hold the exercise band, or you can tie the band to a fixed object. Your foot will be in dorsiflexion as your ankle goes up against resistance and down. Go as far as the pain allows. Repeat 10 times. Now hold the band yourself. Hold your foot upwards and push down against the resistance. This will put your foot in plantar flexion. Bend as far as possible and as comfortably without pain. Repeat 10 times. These exercises will help because it's the same movement as walking. If you improve on this exercise, you know that your ankle rehab is working. Proprioception exercises are thought to be important in avoiding recurrent ankle sprains. The neuromuscular control you have over your muscles will have been damaged when you injured the ankle, as these small sensors are located in ligaments and tendons. Balance type exercises can be used to improve this function and help avoid future ankle injuries. An ankle wobble board can be used, initially in a sitting position, followed by standing on both legs and progressing to single leg balancing. If you don't have a wobble board, simply balancing on one leg can be effective. Once you can manage this, you can challenge your balance by balancing with your eyes closed. Don't try these exercises if you could not have done them easily before your injury. If you think you would have felt unsteady doing these exercises when your ankle was healthy, you are at risk of falling when you try them with an injured ankle. You should not feel pain as well when you do this exercise. When rehab exercises are not followed after a sprain, the ankle can become weak and unstable. Ankle sprains take an average of 6 weeks to heal, but can take up to 4 months depending on the severity. An ankle brace, as well as a supporting shoe or any other form of ankle support, should be worn during this time to protect the ligaments. Stretching exercises should be continued daily, and especially before and after physical activities to prevent re-injury. Even after your ankle feels better, continue with muscle strengthening exercises and balance, and control exercises several times a week to keep your ankles strong. In general, you can start these exercises after you're able to stand without increased pain or swelling, as long as you do not feel pain while you do them. If the pain is severe, use crutches until your doctor tells you that you can begin to bear weight. If your pain is bearable, you should try to walk or bear some weight while using crutches and a protective brace, because these activities promote healing. Running may begin usually as soon as walking is pain-free. Follow these guidelines and you'll be back in the field in no time.